With that, let's go ahead and move on to the dental access follow-up.
It's me, Brad. This is
Yeah.
Linda. I don't think we took action to approve the minutes.
Oh, I'm sorry. Thank you, Linda.
I'll move adoption of the minutes.
Thank you so
Second.
much. There a second?
Second.
And would people like to vocally vote and or do a thumbs up reaction or
Approve.
Approved.
Approved. Why don't we in the future just say those for say yay, those against say nay? Because we're not likely to get any nays, is my opinion.
Thanks, Teresa.
Sufficient.
Let's do that since I didn't hear from everybody. Those in favor, please say yay. Or yes.
Yay.
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 We got a chat. We got everybody. All right. Any nays? Fantastic. Thanks, Linda, for reminding me.
No problem.
Let's go ahead and move on with Kristen.
Thanks, Brad. All right, so I'm just going to start with mail order RX update since it's first on my list. Part of my follow-up was to try to determine who ships those medications or who's the mail carrier for those prescriptions. I contacted CVS Caremark, and of course the answer is not straightforward, but what they did tell me is that for very rural communities, the United States Postal Service has an obligation to deliver. UPS and FedEx do not. So I popped on over to speak with my neighbor, who is the rural carrier for Crooked River Ranch. And he said, yes, we tend to be the ones that are delivering the prescriptions in that area as well. And he did say that prescriptions are considered, excuse me, prescriptions are considered priority mail and should be treated as such, but also was like, I recognize that the United States Postal Service hasn't been perhaps as reliable as we'd like. But please know if you live in a rural area and you choose to participate in our mail order pharmacy program, there's a strong possibility that the Postal Service will be the carrier delivering your medications. Let's see. I actually had a CAC member reach out to and provide some feedback when they were in their clinic. They didn't really see any information about mail order pharmacy posted, and sort of got the impression that maybe their providers are unaware of this benefit as well. So I took that feedback to our provider network group. So that's something that we're working on as a team to figure out how do we also let providers in our network know that they can sign their patients up for mail order pharmacy through their medical record. So we're working on that internally to provide some education to the providers as well. And we are still collecting the feedback from the CACs in our other regions. So once all 4 regions have been able to provide that information, then all of the community health coordinators will get together and sort of brainstorm some ideas for how to provide more education about this benefit. And then we're going to bring that back to all of our CACs to get your guys' feedback and recommendations for any kind of member facing letter or any kind of thing that might be posted in a provider's office. So I'll be circling back hopefully early spring, or I'm sorry, late spring, with some additional asks of you guys. And then with dental access, it's a quick update. I am attending my first dental access work group on the 23rd. So next Tuesday, my 1-year anniversary with Pacific Source. And I'm hoping to learn a lot more about how they're working to improve dental access. I'm also working with Tanya from our community partner outreach program at the Oregon Health Authority. She comes from the world of dental care organizations and has a lot of experience there. So we're also working to educate our community partners that work a lot with our members, so they are also aware that there's other things you can do, like call the dental care organization directly and some things like that. So more work to be done in that space for sure, but know that it is on the top of our mind. And also, I just have like a quick number story, if you guys don't mind, that I was hoping to share. Molly Tiroli sent this along. She was in this position previously, so I'm just going to read it real quick. The member support team at Pacific Source received a call from a member who's a caregiver to her medically fragile mother and has 4 children, including a newborn infant. She works full-time, but had to miss her shifts at the grocery store when she had COVID and while recovering from childbirth. Her husband's construction jobs were also put on hold due to COVID. Due to a lack of income, they didn't have food, couldn't pay their bills, and had nothing to give their kids for Christmas. Our member support team helped connect them to local resources to find more affordable housing and utility assistance. They were also able to pay a bit of back rent so the family would not be evicted. They got them set up with a food box delivery through a local nonprofit and also made a referral to Toys for Tots so their children would have something to open on Christmas.
Oh,
So that's just one example of the amazing work our member support and case management team does. So I just couldn't resist sharing that.
thank you.
Thanks, Kristen.
Thanks.
All right, any questions or comments related to Kristen's, what she shared with us?
So will we next meeting have more information on the dental access program?
I hope to learn a ton on Tuesday and just be connected with the right people to ask more questions. So I hope by next month I have more of an update on that for sure.
Okay. I can tell you from experience that, yeah, I know you can call the other dental care organizations. Pacific Source will give you their direct numbers, but you call them and they list who's available, if any, and time after time, those are not correct information. So they're not taking new patients. So you go, I personally have gone round and round and round and round looking for a dentist, and all I do is get passed. And I'm still in the same place I was 6 months ago, FYI. So you're welcome to call me and I'll give you my personal story 1,000,000 times if you so desire.
Also, the barrier there too is you're assigned to a certain DCO or whatever it may be.
Yeah.
And so you go in to schedule that appointment, then they're not accepting patients. And so you try another place and you're not assigned to that DCO. So you have to switch out and it's not very easy to do.
Right.
Sometimes you run around. And so if you only have a half an hour lunch, as a member, you don't have enough time to switch that stuff out.
Right.
Or they don't know how to navigate it.
That's very true. They don't know how to navigate it. No offense if I'm offending anyone, but the DCOs will then they'll give you information of dental providers that are non-existent. Either they're
Right.
not really taking patients or their list is really outdated. So that's a big problem to figure out how to keep those up to date. Because that's a lot of time that we spend researching, because basically you get passed from the DCO to the various dentists who aren't taking you anyway, and you hit a wall. Anyway, you probably know this. And I've been hearing the same story for 3 years, and I'm sure. So it should have been solved, in my opinion, 3 years ago. So now I'll shut up because I don't
Thank you,
know.
Teresa and Regina. Yeah, thanks for that input. That's important. That's what we're here for. One of the things we're here for, right? And we're going to move into actually the CCO grievance and appeal process, which kind of came out of actually the board meeting and my sharing of what I just shared with you today from those focus groups we did and the families that had bad experiences with providers. They were happy to have the Medicaid coverage, but not having great experience with providers here in Central Oregon. And question was, what can they do about it? And so Pacific Source is here with us today, their grievance and appeal folks. So take it away.
Thank you so much. And again, thank you for having me here today. I'm really excited to hear your stories as well as share with you a little bit about the appeal and grievance process. You can go ahead and go to the next slide. The one thing that I wanted to start off by saying about the appeal and grievance process is it sounds a little intimidating. The words, it sounds super formal, and it may be something that does not want to be accessible to you as members. But it is informal in the sense that you can just call us and we'll talk a little bit more about that. But since we're starting off talking about appeals, I wanted to at least frame that up right away. So an appeal is anytime you would request Pacific Source to look at a denial again and see if we can change our decision. So if you received a denial regarding an authorization of some services, medications, even the unfortunate event you received a denial of a claim, you could call us anytime and ask us to reconsider that, and we would process an appeal. What that process entails is a great group of folks who pull together and turn over every rock and find as much information as they can to help find the right solution and end goal to getting you what you need. Our medications as well as medical services that are denied, they're actually reviewed by a Pacific Source medical director who was not involved in any of the other decisions or denials that you may have received. So that's a benefit to you to have that independent new look. Downstream, should there continue to be some denials, the state does afford you additional rights through hearings. We're not going to dive into hearings at all today because we usually try to resolve things as best we can through that appeal process. The next slide, please. So through the appeals and grievance process, you can also submit a complaint about anything. And it's anytime you are dissatisfied. In fact, today, some of the stories that I've heard, those are complaints that we want to know about. What we do with those is we investigate thoroughly. We call it a root cause analysis, where we try to find the root of the issue and resolve it or make some improvements to minimize the impact and the dissatisfaction. As noted here on the slide, it could be anything from the care or the service that you received from the provider. It could even be the service you've received from Pacific Source. It could be the quality of care that you've received. Maybe you felt that your provider did not spend enough time with you. It may even be the materials that we have sent you. Those complaints that we get, we actually trend those, and we can go to the next slide. We use all of that data to formulate an assessment of where are the opportunities we can improve. So earlier I mentioned, how do you do this? It's informal. You can call us. Our customer service team is well equipped to take those. And in fact, you don't have to ask for a complaint or a grievance specifically. They are trained really well to identify the tone and the dissatisfaction. You could write us, you could email us, and we are working on an anonymous feedback mechanism in which you would be able to share your dissatisfaction or experiences that have not been pleasant in an anonymous way, so that you wouldn't necessarily have to go through those formal processes. Next slide.
Jessica, did you have more?
I do. Can we go to the next slide? Sorry, my audio may be cut out there. Thank you so much. So the purpose of doing this, obviously we are required to by the state, but more importantly, we want to acknowledge that there's always room for improvement with the systems, with the plan itself, and we use that information from your feedback through those complaints and those appeals to work with internal mechanisms as well as external providers to improve the quality of care, the quality of the service, Things like the feedback this morning regarding the prescription app. When we have a trend that is related to those types of things, we work with our partners to improve those so that you are able to not have to struggle with processes and obtaining the care you need. Sometimes it involves educating and partnering with our providers. We acknowledge that you may not have a positive experience with a provider. We want to know about that and we want to work with them. What's really important about the work we do with educating and partnering with our providers is your personal information is not relayed. We do not want to create an adverse or any kind of relationship strain. So we keep that information private. We don't use that to share with providers or even internally. Just the content of the issue is what we use. And that's a really important part. Hopefully that information helps you trust the appeals and grievance process so that we can use it to help you and do better. Next slide. Here are just some pieces of contact information, our 1-800 number, as well as our email or mail. It is a very seamless, easy process. It does not require a lot of forms, a lot of signatures. We do what we can to make it as easy for you as possible. That was all I had regarding the process. I really wanted to open up and see if there are any questions about the process or any other questions that you'd like to ask me today.
Thanks, Jessica. Anybody? Does anybody have any questions?
Yeah, hi, this is Larry. And I just have to do my usual thing. I'm just so constantly impressed with Pacific Source and the positive culture you have there. And I just often wonder how you guys have created such an amazing positive culture there. So just want to compliment you on that. That's been my total experience always with Pacific Source.
Can I just share that the reason why is because of Ken's leadership, and he was so kind to join us today. His example, the leaders at Pacific Source are incredible.
I would say it's because we have really great people.
Fantastic.
So I have a
Anybody else?
question.
Yeah.
So years ago, I had a provider that was unwilling to give me a medication the therapist had recommended, and I didn't call anyone, but I received something in the mail asking to review and thing about that situation. And this has been years. That provider's no longer there, so it's no longer. But I never received any follow-up on that. No one ever contacted me to know if she was spoken to or anything. So I just wanted to share that.
Thank you. My audio on my end broke up a little bit. And so if I may, I just want to make sure that I heard you correctly. You had an experience where a provider was unwilling to prescribe a medication, and you had reached out to, was it Pacific Source? I think that's the part where it broke up for me a little bit.
Yes, I had been on Pacific Source at the time. Yeah, it was gotten in the mail to just fill out for my experience.
That's definitely an unfortunate situation. I can tell you that when we receive any kind of complaint at Pacific Source, specifically with our members who are on our Medicaid plans, we have to respond in writing to any complaints that we receive. There's always those isolated instances where something gets to the wrong person, and we definitely want to know when you haven't received something that you're expecting. Please feel free to call in and inquire about that. But I'm sorry that happened. That's definitely not something we want to see, but thank you for sharing that.
Sometimes if I could, I think, if OHP has your address as one thing, and you don't do your update with them, they might also have the wrong address on file. You can't call Pacific Source and change your address just with them. You have to go through OHP to do it first. And so sometimes that mail doesn't get to you because your address was not updated in both places.
And
Go ahead.
follow up, I just was wondering, were you able to, in that situation, were you able to get the services that you needed or the medication that you needed?
I didn't, because after that situation, I also stopped seeing therapist and went a different path, but it's
Okay.
not an issue any longer.
Thank you.
I'm just curious to follow up on Regina's comment. Is it not possible to have that change of address thing go in
Well,
both directions?
Well, when you originally sign up for OHP, you have to go through the state, right? And so anything that you do with the state, they have to use that information, and that information from the state goes to Pacific Source. So say like you move and they decide, and a lot of people, they do move and that's not their priority, is to change their address with OHP. And so if that address never gets changed, and like her, if she did that appeal, or it was just an appeal that was maybe sent through or given to her through her doctor, or however it may have been, and she sent it into Pacific Source, Pacific Source only has that address that OHP has provided to them. And so if you call into Pacific Source, it's easier to call into Pacific Source than it is OHP. To change your address, they can't change your address unless OHP gives them an okay and you update it with OHP. And so that's where the communication gets lost too.
Yeah, thanks, Regina. So I was asking, is it not possible to, if somebody calls Pacific Source and to change their address, that it can go the other direction from Pacific Source to OHP, or do they have to go OHP to Pacific Source?
You have to go to OHP so OHP could update Pacific Source.
The easiest way to do it is through email and not to call them, because calling takes forever, but you can do it through email.
But it has to go through them, the state first.
Right, but if you, I'll try and write that email in the chat, but it's easy because you just tell them your address changed and they send it back and say thank you. So I'll put that in the chat. Because I've waited on the phone and that's very long, so.
For hours.
Yeah, I've done that. Shoot.
Terrible.
Where did I go?
All right, any other comments along the lines of grievances and appeals?
How long do they take?
Questions?
I disappeared. Oh, there I am. How long do appeals take?
That's a great question. It depends on the type of appeal. What I can say is, regardless of the kind it is, and when I say kind, like if it's about a medication, it might be faster than a standard medical service that doesn't have an urgent need. So it can take anywhere from 72 hours to 14 days, and then there's some extension times in there. I'd like to, in general, say that you should hear back from us in less than 45 days across the board for anything.
Okay, I meant to say grievances though, not appeals. Is that the same timeline?
In general, yes, we try to have them within 5 days. We acknowledge you. So you should receive something from us in writing within 5 days of receiving that. And then subsequent to that, about 14 days with potential extension times in there, less than 30 days.
Okay, I have not. So if you haven't heard, got the initial, we acknowledge this, but I have not heard anything since. Do you just call? Do you call Pacific Source?
So absolutely. Was the complaint directly with OHP, or did you submit it with Pacific Source?
Pacific Source.
Okay, yes, you would definitely want to give us a call back.
Okay.
And if you want, I can take your name. I can actually do some research.
Okay.
If you would like.
Sure.
I can do that for you. And then I can round back. Kristen, would it be okay if I round back through you with information?
Absolutely.
Thank you.
And I
Thanks.
actually had asked Rihanna to join the call. I know we're sort of over our time, but if it would be helpful and if there is time, we'd be happy to walk through sort of what a call to file a complaint looks like. But I understand too that we're over. So I'll defer to Brad and Michaela and Gwen on that.
That would be very helpful.
Thanks, Kristen. Let's go ahead and do a check-in because we are a little bit over time according to the agenda. The next item on our agenda is process development for how the CAC manages emerging issues, and we've got looks like 30 minutes set aside for that. Do Gwen and Michaela think we can pull that off in less than 30 minutes? Of course, we have to. But
Michaela,
much less than 30.
Michaela, I'm wondering if we want to adjust something to make space for the phone call trial and shift one of the 10-minute agenda items elsewhere.
Yeah, I would recommend that we bump one of those 10-minute kind of updates to next month.
Okay.
I'm guessing the stipend piece, that shouldn't take 10 minutes, right? The last item.
Yeah.
So how about this, Rihanna? Can you do it in 5 minutes or less?
I can sure try, yes.
All right, we'll find time in our agenda, so go for it.
All right, we're just gonna kind of make this up on the fly. They did this in the Gorge and the CAC members there found it really helpful. So I'm a Pacific Source member calling our grievance and appeals team. So ring, ring, ring.
Thank you for calling Pacific Source. My name's Rihanna. How can I help you?
Hi, my name is Kristen and I would like to file a complaint, please.
Absolutely, I can help you with that. Before we get started, can I verify your name? Your full name?
Kristen Tobias.
Thank you. And is it okay to call you Kristen?
Absolutely.
Thank you. And can I have your member number? Go ahead and ring it.
It is 0187264.
Great. And really quick, if I could verify your date of birth, I can take down your information.
That is October 16th, 1978.
Great. Okay, well, I'm sorry that you're calling with a complaint today. Why don't you tell me what happened?
I called my doctor's office this morning. His name is Dr. Smith with Smith Family Medicine, and was told it will be 5 weeks before I can make an appointment to be seen. And I need to be seen sooner than that.
Oh, that is a long time. Before we go into some options that we have, I just want to make sure there isn't any urgent medical needs that you have right now that would require urgent care or emergency room? Okay.
No.
Okay, good. That is a long time to wait. And I'm happy to take the complaint. Would you mind, I just want to ask, do you want to stay with Dr. Smith's office or would you like to change your provider?
I would be open to changing my provider if the wait times are going to continue to be this long.
Okay, well, here's what I can do. The complaint process is available to you so that we can kind of take a look at these things, contact the provider's office and see what's happening. It's a good mechanism for us to just touch base with them and see if there's anything we can do to assist as well. If you'd like, I can take the complaint and file it as a formal grievance. That will ensure that you receive a response from us in writing. Because you are waiting for a doctor's appointment though, I'd be happy to give them a call and then call you back in the next few days just to let you know if there's any wait times, if wait time has changed or if there's any additional appointments available if you'd like to stay with Dr. Smith. If you'd like to explore a PCP change after that or a doctor change after that, we can do that and I can put you in touch with one of our customer service representatives and they can help with that process. Do you want me to look into that for you and get back to you with some information and maybe some additional times, hopefully?
Yes, please.
Great. Okay, and just to make sure, Smith Family Medicine, and that is on Compass Street?
Yes.
Perfect, great. I will give their office a call. like I said, I'm going to give you a call back within the next 2 days just to give you an update on what's happening, but you will receive a letter from us as well. Do you have any questions about the grievance process?
No, this is very helpful. And I look forward to hearing from you in the next couple of days.
Great. And I'll also give you my name and my direct contact number too, just in case you don't hear back from me if we don't get connected. It's Rhianna, R-E-A-N-N-A, and my phone number is 541-555-7726.
Thank you.
Thank you, Kristen, for calling, and we'll be talking soon.
All right. Thank you.
Bye.
And
Nice to
cut
meet you.
scene.
Great job.
Thanks.
Under 5. High five,
So
Kristen.
we just
That was
wanted to
easy.
demonstrate that it shouldn't be an intimidating process. We want to hear your feedback. This is the only way that we can make improvements. So please, when you hear stories or you experience, issues yourself, please let us know. It's super helpful, and Rhianna and her team and Jessica try to make it as easy as possible.
Thank you. That was great. Hey, I wanted to ask a quick question. Is there a way to text to a telephone number at Pacific Source with a complaint or anything else? Is there any texting available? A lot of our Latino families do a lot of texting.
Not that I'm aware of, but that's definitely something to explore. So I'm going to take a little note. I think with texting, it's just sometimes issues about whether or not there might be like personal health information shared. I think that would be our biggest concern, but I'll certainly ask.
Okay. All right. Well, thank you very much, Grievance and Appeals team, Pacific Source. Let's go ahead and move on to Gwen and Michaela with our process development section.
Hey everyone, so we're shifting gears. We're shifting from looking kind of outward at the CCO and shifting to looking inward at CAC. One of the things we all have identified that we want to do is develop a process for managing emerging issues, things that come up during our meetings. Sometimes they're an individual conversation, sometimes it's a bigger issue, and trying to figure out what do we do with these things. And there's a couple ways we can do this, and we wanted to involve you in the conversation of how do we even go about developing this, because this is part of community engagement. Next slide. And there's a lot of different models, and you've experienced some of them in different ways in different parts of this meeting. And the thing that we hear from you folks is, we want to be more involved. We want to have more authority and power beyond what we've been doing so far. And so bringing this conversation to you as to how do you want to develop this process is our, part of our attempt to do that and have you have a say in things. So the process that we're talking about, as I mentioned, is how do we address emerging issues? And in the slides that Michaela sent for me just an hour or two ago, and then what you see on the screen is a continuum or a kind of a picture of how folks like you and us can partner together and do work together. On the left side, you see what's called inform. And for the purposes of this, stakeholders are you all, the CAC members. And the organizers, I'd say, would be probably staff. And so you can see from the left to the right, it moves from receiving information and being informed to actually co-creating whatever it needs to be co-created. So you've got informed, this is what happens, this is information. Then we move to consultation, where you can see from the style or the conversation at the bottom is like, here are some options. What do you think? And we've done that with you for example, with the grant process last year. We came up with a plan. We shared it with you. You helped inform it and give us some ideas, tell us what you thought, and we tweaked it and brought it back and used it. Then you move to the middle realm and it's involve. And it's like, here's an idea, here's a problem, what ideas do you have? And so checking in with you throughout the process. And so if we were to expand, looking at that grant process again, expand how we did that to making the decisions about what's funded. That's kind of more involving you. The staff aren't making the decision, you are involved in that. And then we move farther to the right with just more power and ownership into the collaborate and empower segments. And that's where it's, really working together to solve a problem, and involvement in every aspect, every step of the way of how do we do this? How do you want this done? And then who's leading it? Is it staff leading it, or is it CAC members leading it? And so there's a lot of different ways we can, go about this process, and we want to give you the choice to decide what's going to work best for you all in this. So what I want to do is keep this slide up for you to consider pondering, and I'm happy to ask a couple questions, answer any clarifying questions about this, and then move into a short discussion to help us identify what method you all want to use for developing this process. So any questions about any of the stuff that I've just spewed out really fast? Okay, so Michaela, I'm going to let you leave that slide up. And as you look at the continuum, CAC members, what strikes you about this? Just like what pops out at you? This is just getting a first glimpse. What's your initial reaction to it?
There's going to be more input that we're going to be offering, more of a collaborative association.
Mm-hmm. Yeah, that's an option. Yeah, so more collaborative. What else? One more thing that strikes somebody else that pops out at you.
Gwen, I have a question.
Yeah.
So what's meant by stakeholders? It's organizations that apply for money, or is it individuals?
So for this, stakeholders means you, the CAC members that are involved in any process that we're building. I was referring to the grant process as an example. So right now we're looking at you're designing a process for you around how to deal with emerging issues. So you are the stakeholder in this one. So think of you.
This is Linda. What I'm struck by is the deep level of listening in the process, that it isn't staff's idea for how we should do it, but really deeply listening for us as the group that needs to be involved.
Mm-hmm. Yeah, so the listening part. And you can see there's a lot of different options. There's 5 different options of how we can go about building this process. Which of those styles excites you the most? Is it inform? Is it involve? Is it empower, consult?
Empower.
Empower?
It's all connected, yeah.
Yeah. Collaboration and empower, says Mandy. Thanks. Mm-hmm. Which one worries you? Because there's some things that, there's pros and cons to all of them. Which one worries you?
I would say information for me, because I want to make sure I have access to all the information. I don't want it to go over my head. I don't want to have an assumption that I'm getting something that I'm not really a part of. So I'm hoping that information is across the board to everybody equally.
Yeah, very good. So having equal access and fully understanding. What are some of the pros and cons to the consultative approach? So looking over to the consult, which is like the second one to the right, consult. What's a positive of that, and what's a negative of using that method?
Gwen, I have another question.
Yeah.
I'm always a little bit in the dark about these things. So who's going to identify the issues that we're going to be talking about, or who's going to bring up the problems that we're going to try to address?
So what we're talking, that's what we're going to decide. And what we're talking about right now is who's going to address those. Is it staff, or are you all going to be part of that conversation? So those are the things that we need to know. Do you as CAC members want to have a part in designing that, or do you want us as staff to bring you something? So this conversation is really about what method do you want to be heavily involved and really partner and build it together, or which would be like a collaborate, empower approach, or do you want to have us do the background work and bring it to you and you can tweak it like we've done in some other approaches. So we're really talking about the approach to developing a process for our group. Does that help, Larry?
Yes, it does. Yeah.
Okay.
And,
yeah, we're not even into this.
I'll just quickly inject it. I think the collaborative would be my preference.
Okay. What would be a positive to that and what would be a drawback to that? Because there's always both. And I think it's always good to go in with eyes open, whichever approach we take.
Well, the positive would be that, I mean, that's kind of our role as community consumers and community members, is that we are supposedly more aware of what the problems are and the situations that need to be addressed. But then you guys could bring the tools to address it in the organization to enable us to address some of these things.
Thanks. What would be one of the negatives to using a more collaborative approach?
Might be a little bit slower.
A little bit slower. What else?
I think I agree with Larry. I think the downside on the collaborative would be having to spend more time again, kind of connecting and getting everybody's input, and it'll be slower than kind of you guys as staff kind of putting it together and then bringing it back to us to give a little input, but most of the work is already done. So there's both downsides and benefits to both.
Yeah, there are, for sure. So speed of which the work can be done, involvement, knowledge growing.
Yeah, and have a time frame of what's expected, the time frame that we would need as CAC members that we have to put out and do this. Whether we do it during the day, at nighttime before bed, after dinner, before dinner. I mean, our schedules are different.
Right. Yeah. Yeah. So what would it look like to build it, which would be part of the conversation? Yeah. If you help build it, you get to decide that. Yeah, good question.
When I look at the continuum, inform, consult, and involve feels as a CAC member like I'm included, but I'm not responsible for the outcome. And collaborating and empowering, I have skin in the game. I am responsible for the outcome. And that means more commitment from me and more time, and I have more at stake, and that can sometimes be a little scary.
Yeah, good point. More at stake can be scarier. More ownership. Yeah. So how would you all like to build this process? I'd like to kind of have CAC folks kind of weigh in, and then I can throw a poll up just so we can make it a little bit more visible.
Yeah, if you could do a poll, I think that would be helpful. I would totally say you guys kind of put it together and then we can kind of give our feedback.
Okay.
Hey, Gwen, this is Brad. I guess I'm not seeing the need. I see that this is a great visual tool that it seems like if we could just bring this visual back up to the CAC each time we have, a specific thing, a specific issue, because it seems like we need the full continuum.
Yeah.
It's going to depend on what we're addressing. Some of the time it's just going to be information. The main thing that came to my mind is that as long as we're not stuck in only getting information, because I don't think many of us are interested in just being on a community advisory committee that just gets information, pushed at us. I think everybody's here to provide their input, to be involved to some level. But the further we go to the right toward collaborate and empower, then we get into capacity and availability issues of CAC members. You know, do we really have the time to, and or expertise, and or, you know, you name it. There may be a specific instance where somebody does, or as a collective, maybe we do.
Mm-hmm.
But it seems to me like we need to utilize this full continuum and just bring it up and ask this question when we're faced with, you know, a specific issue, specific opportunity.
Yeah. Yeah. So we can totally keep using this, and yeah, for sure. And this opportunity, like to build this decision tree is another. So let's do this to get a feel, because I've heard some positives and some rather to do more consultative. I've heard some folks willing and interested in doing more collaborative. I'm going to put a poll up. What I'd like to do, the way it's set right now is I'm really curious to hear and to elevate the consumer representative and community member voice. And so there's 3 choices, whether you're interested in consultative, collaborative, or abstaining because you're not a community member or consumer representative. So let's just kind of take a pulse of that and see where our community and consumer members are, because there's a lot of ways we can work through this as well. So I'm going to go ahead and launch that. It's all, and you can see it on your screen, and go ahead and make a selection.
Do you want a verbal for phone people?
Sure, that'd be great if you're comfortable doing that, Chris.
I'm okay. Collaborative.
Okay. Michaela, maybe you could put that in on the poll side. And Elizabeth, where would you like to head? You're on the phone as well.
Some collaborative.
Okay.
I can't see the slide, so.
Yeah, it's in the
You
email.
know,
So I need folks to go ahead and make a selection. I'm not showing that. Did you get it up? Is it on your screen? Okay, I got a thumbs up. Thanks, Donna. I'm not seeing that anybody. It's not showing on my end. Okay, thanks for the dones, because I'm not getting anything on my end.
I've completed also.
Okay. Has everybody completed it so far? It's pretty quick. Give me.
I have.
Okay.
Lauren did.
Okay. I got
Yeah.
a copy there. Let's see what I got. All right. It's not coming up. I'm going to relaunch it. Let's try it one more time.
Okay.
Because I'm not getting anything on my end. We might need to do. The
All we
chat.
do is we tap the line that we agree with and hit submit, right?
Yeah.
Okay.
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 It's not registering on my end. So let's do this. In the chat box, if you would put collaborate or consultative or abstain for CAC members, that would be great.
This is Lauren. I don't know how to do a chat box yet.
Yo.
Collaborate. I'm sorry. I haven't gotten that lesson, so I can't chat. Collaborate,
Great.
please.
And Michaela, can you help me tally this up in a visual?
So I see 7 collaborate and 2 consult.
Yeah, I'm kind of there as well. Yeah. Okay. So let's go ahead and move in that direction, because that's pretty broad. And I think recognizing that folks have different capacities is fair. And we can talk about how that looks for folks. Does that sound like a fair place to start? Okay, so we're going to move forward in the next, 10 to 15 minutes. For those of you who have computer access, I'm going to put a link. We're going to do some small group work. Those who are more savvy with computers can click on this link that's in the chat box to open up a new Google document. And this is going to be a document for us to start both learning from each other and actually working on developing this process. To do this, what we're going to do is break up into 2 groups. Go ahead and go to the next slide and let's look over the slides. We're going to break up into 2 different groups. We're going to split up the slides, answer the questions, and then as time allows, switch slides. So each group will have an opportunity to answer the questions on the slides. So I have the blue group are going to start on the blue slides and answer the questions on slides not 6 and 7 anymore. They're on slides 2 and 3. Because I pulled them off, and then green, we'll start on the green slides, which is on slides 4 and 5. And we'll have probably like 6 to 8 minutes for each color, and then swap slides to the other group. And this is going to be just for CAC members that will be going into the rooms. So other folks can hang out and have a little party in the main room without us. Kelsey, may I make you host?
Certainly.
Pull us back. Everything's set up for an 8-minute breakout.
8 minutes,
and
got
then
it.
Yeah, and then we'll come back and then just clarify that we're going to switch slides. The groups will stay together, and I need to reallocate some slides. I'm going to go there. Okay, yeah, we're good to go with our groups, so I'm going to make you host.
Okay.
And then if you'd like to send us into our rooms, Michaela, you're with the blue group, I believe.
Gwen, it didn't save when you handed me host powers. It erased the rooms that you had set up. So I'm gonna do my best to recreate them really quickly.
Okay, thank you. My apologies. I didn't know that happened.
So you and Michaela just want to be in separate rooms?
Yeah.
Got it. You get tired of each other?
So Gwen, real quick, just to clarify, so the rest of the agenda today, are we going to move those items, the other 2 items, to either an email correspondence or our next meeting? Is that the plan? Because 16 minutes will take up the rest of our time.
Michaela?
Pretty much.
Yes, that would. So the RIP update, there was a link to a video from our board of directors meeting that we could move to next month and answer questions from that. The other thing that I had on deck was a decision for an alternative to checks for stipends and reimbursement that I would need a CAC decision on. And if there's not enough time remaining today, we can move that to next month as well. It's not time sensitive.
Okay, thanks.
All right, we are ready to go.
Okay, thanks. Sorry, everyone.
No problem. We'll see you in 8 minutes.
Thanks. Nice work, everyone. I know I had fun in my group. So how did it go for everyone? Thumbs up, thumbs down?
Thumbs up.
Thumbs up, good. Okay, so the next step is we're probably looking at where we're at. We'll probably, we might be able to gather a little bit more information on the second of everybody's slides, and then we'll bring it back at our next allotted time period for this, and actually start kind of building and drafting a process, what it could look like. We'll probably do continued work in small groups. We'll make it as visual as possible, and look at what would the flow be. So
I hope we have more time to, when we get those questions, Gwen, I'm just going to say, it's like we get to jump for answers. And I hope that's not, I mean, we're making big decisions here. We got to think about it. So I hope that that's not the way that the process is always going to be.
Yeah, well, and you bring up a good question, and we can kind of survey that. Is there additional time that folks want to put into this outside of this meeting time? And so we can look at that and explore that as an option too. So yeah, we have a lot to accomplish and never enough meeting time to do it in this setting. So all
Thanks,
right,
Brent. Thanks, everybody.
Michaela.
Thank you. Bye.
Thank you. Take care.
Have a
Thanks for
great
the
one.
opportunity to be here. Thanks, everyone.
Thanks for being with us, Ken.
Thank you.
Yeah.
Bye-bye.
Bye.